What's up, guys? We are back for another Black Wednesday, Titan style. So it's Titan Black Wednesday. We're doing it up. What's up, Jared Delgado? So everybody's coming back. What's up, P-Tag? Hi, how you doing, guys? What's up? We are getting it on right now. 3 o'clock. Hope everybody's having a great Thanksgiving Eve so far. I don't know if you're working like we are still, but we're here for our patients every day. All day, we are here for our patients. Call, text, and emails. We do respond. We will be attentive to you. We will make sure. And if not, you let me know personally, and I'll make sure it happens. So at that point, I want to welcome you guys all back. I'm waiting for everybody to join, and it is joining quickly, so I appreciate it. If you guys have any questions, put them up. I'll be more than happy to answer them. And we'll start going through everything. I want to start off on telling you guys, what's up, Sam? How you doing, man? Hello, Bessandra. How you doing? So let's start off with what we do here at Titan Medical Center. So we service nationwide. That means we service the whole United States, right? Everybody. And we do blood testing, whole United States. So we can send you in for a blood test in your lab. Our doctor will set that blood test up for you in your lab in your local zip code, right? You don't have to go to a lab. You don't have to go to your doctor to get it. We take care of everything for you, all right? We do bioidentical hormones, males and females. So we all have the same hormones in our body. It does the exact same thing. We just need them at different levels. And at that point, we can help you fix that. If that's a problem, we want to make sure you're at optimal health and optimal levels. So at that point, we want to make sure that's why we do the blood testing for that. Now, we also do vitamin amino acid injectable therapies, and a lot of them are niche just to our clinic. That means that we are the only ones that have like Hercules Potion or Titan Complete and stuff like that, or Titan Ultra. You do not need a blood test for our vitamin and amino acid injectable therapies. All you have to do is basically fill out some new patient paperwork, get it back to us. You will do a visit with a medical provider, and at that point, the pharmacy will ship you your medications. We don't hold any medications. We don't make the medications. The pharmacy does, because everything is doctor prescribed in your name. All right. Do you have a male member? What does this say? Do you have a male member? Oh my God. Hey, buddy. Hope you're doing great. Thank you. I appreciate it. If I had full labs just ran, can I use that blood work panel and then pay? Yeah, absolutely. So if you have your own labs too, we can use those for the hormone replacement therapy. It just has to be within the 60 days, and it has to be all the tests that we need, okay? If you have all those tests and it's within 60 days and everything's good to go, we can set you up for your doctor's visit, and at that point, we can help you out. So we do libido enhancers, so sildenafil, which is Viagra, the main component, right? That's the chemical. Tadalafil, which is Cialis. We can do it a lot more inexpensive than you can probably do it through going through your doctor and getting it prescribed and even getting it covered by your insurance. I think they charge like $20 or $25. I know like Romans and out there, they're starting to do it too as well. I think we can get them too. We beat them at the price. So at that point, we do rejuvenation detox. So we're talking about liver functions. We're talking about the inside, outside of like anti-aging, feeling better, and making sure the inside is looking just as good as the outside is. If you do that, so that's what it is. Let me see here. Hold on 1 second, guys. Sorry about that. I was just saying why I waved to all the people that are out there that I could. I don't want to take too long. So we do rejuvenation detox, like glutathione. Glutathione is a super antioxidant, guys. It's produced in the body naturally in the liver, but it gets depleted fast, so we need to supplement in some way or shape or form. Oral glutathione doesn't work as good. They have studies on these things. So at that point, you can kind of look at it. So what are we going to give away today, guys? We are going to give away free blood tests on here. We're going to give away 2 free blood tests, Facebook, Instagram. We're going to do both. So if you guys are tuning in, I'm going to pick 2. We're going to give away free Titan gear, shirts, leggings, hats, whatever you guys want, V-necks, all free, going out to you. We're going to give away a free doctor's visit for amino acid and vitamins. So at that point, if you want to try possibly the Titan Complete or Hercules Potion or one of these vitamin amino acid injectables that we have here at Titan Medical Center, it will be open for you to do. And at that point, you can take advantage of it and maybe see the benefits where before you didn't know and you might not want to invest the money. But after you do, I guarantee you'll see exactly why everybody is talking about it and why everybody raves about it. I take all these injectables myself. I love them. I mean, it's definitely helping me out in a lot of different ways. From cognitive enhancement with the Titan Ultra, glutathione definitely for feeling better in the super antioxidant, building my immune system. So that's huge, especially right now. Right now it's like flu season, cold season, germs, people getting sick. Even a normal, regular day, you send your kid to maybe school or preschool, or somebody's watching them, or they just go out in public, or you go out in public, maybe you're in an airport, or some public place that has a lot of traffic, and you just get germs. You're going to touch things, even if you wash your hands a million times. Now, that's the best policy, and cleanliness. You definitely want to wash your hands as many times, especially after you go to the bathroom. At that point, you want to build the immune system as much as possible. It's fighting a lot of different things out there. We're breathing in a lot of toxins. We have a lot of chemicals and stuff like that. Free radicals through the body. You want to make sure we keep those down. So super antioxidant, that's the best, glutathione. Rejuvenation detox. That's why I wanted to bring it up, because everybody asks, like, what's rejuvenation detox? So I wanted to bring it up. Hercules Potion. Mark knows about that Hercules Potion. That's the best, right? GR Perez, definitely, man. Hey, listen, stay tuned. We're definitely going to be giving away some of these things. Even if you don't win, I want to bring this up. Our Black Wednesday giveaway, you still win. And the way I say that is today only we have specials. So we have specials on the male and female blood panels, no matter what. So if you're a new patient, you're an old patient that needs a follow-up blood test possibly, we will help you out. How we're going to do it is this. It's usually $200. We used to discount to $150. It is $130 for you guys. So full male panel is $130. And that's going to cover a variety of different tests from liver, kidneys, electrolytes, prostate, blood cell counts. We're going to check your cholesterol panel, full thyroid panel, IGF-1 levels, free and total testosterone, progesterone, and estradiol. It's going to cover a lot of the bases that you guys want to look at to see what is going on and how your body is functioning. Hormones run most of our body's functions, I mean, in some way or another. So at that point, they're directing what's going on. So you want those to be at optimal levels. You want those to start working right. The next thing is at that point, we're going to do a female panel. It's usually $300. We usually discount to $225. We're going to do it for $195 for females. So if you know a blood panel that you need, this is the time to get your blood panels. It is a full panel, and you get all those tests included. The females do have a couple more panels added on to their full panel for females, so that's why it's a little bit more expensive, but you're getting more testing on there. So I want you guys to be aware of those specials. Get ready. Shout out to the Titanettes for being good, taking care of us. Yes, shout out to the crew. I'm going to go mobile to show you guys that hopefully next time. I just want to make sure everything's working right for the cameras and you guys are hearing me and all the audio is right and all that good stuff. Another thing, for new and old patients, $25 off anything except for the blood test I'm giving you a discount on. So Titan gear, Titan therapies, doctor's visit, whatever we do, we're going to knock it off you for $25 in total, okay? So at that point, I want to help you guys out, see what I can do for you guys. I'm trying to add something in for everybody so I had all the bases covered, and you guys were happy, right? Because that's what it's all about. I want to make you guys feel good, look good, be happy, you know, happy wife, happy life. Make sure your significant other, whoever it may be, is happy too, all right? That's what happens a lot of times. A lot of times, either the guy or the girl comes to us, we get them right and optimized and everything like that, and things start changing. And then, you know, the partner starts seeing it and they get really excited about it. And they're like, well, I want to feel like them. I want to feel good. I want this. And then they start coming to us and they both start doing it. It's a really happy marriage, per se, for all three parties. It's really, really cool. So I'm happy about that. I'm happy to help people. I want, you know, people to be happy, you know, with coming to us, coming to Titan, and for us to take care of them. So let me get into some of the other things we were going to talk about today. So we're going to do the Titan giveaway for the gear, the Titan gear. So hashtag Titan gear, right? I want you guys to do it on Facebook. I want you guys to do it on Instagram. What up, Dave Hensley? What up, Mina? What up, Eric? Pepper Banks in the house. Man, I ain't seen you in a long time. Christy, how you doing? Jason Forrester, how you doing? All right, so hashtag Titan gear, all right? Just got my Hercules Potion today. Yay, Titan Medical. Oh, yeah. So wait, if you haven't had that Hercules Potion yet, I love it. A lot of people ask us when they should use Hercules Potion. I usually use it 30 to 45 minutes. before the workout or strenuous activity, whatever you're doing, you can take, whatever you want in the injection. It's usually intramuscular. A lot of people who haven't done injections before, we tell them to go into the deltoid. If you guys have questions about injections, where should you take your injections? First off, you can call, text, email us, right? Number two is, you should have got instruction videos that direct you to our YouTube channel that show you about all these injections, the sites where you should be injecting, and how it's going to help you to inject in these areas. Because if you do inject in some areas, it's not going to feel as good as it should going in, or you might have an issue. You want to make sure that the needle is going in at a 90-degree angle at most of the vitamin and amino acid injectable therapies. If they're going intramuscular, if they're going subcutaneous, they want to be at a 45-degree angle in subcutaneous fatty tissue. So at that point, just make sure you know what you're doing. And if you don't know, we're here for you. That's what we're here for. That's why I paid this medical staff. That's why I have this medical staff and these people here. It's for you guys. We literally have 2 doctors, nurse practitioners, so we have 3 medical providers, even in the house right now. So at that point, if you guys got questions, concerns, our medical staff is here to help you. Is TRT injection better in one spot over another? So, retention rate, I can't tell you for sure, because everybody, they might assimilate it in their body at a different rate or a higher rate than others. So you can't speak for the masses. The best thing to do is to do a bigger muscle group so the body can absorb it better and disperses into a bigger muscle group, so you're not wasting any of the injection per se. Because if you were to go in a very, very small muscle, usually you're going to be able to inject 1 ml or half ml or even 1.5. You start getting like 2 mLs and stuff like that, it's going to be a little uncomfortable in some areas, and some areas might not be able to take it as others. But see, this all depends on the person, and this is why I go back to not being cookie cutter, because everybody's different in size. So somebody might have a bigger muscle in their shoulder, might be able to take more than a 300-pound guy to a 80-pound female. They're going to be a little bit different in their muscle structure and how and where they can inject these things. So at that point, that's what you want to do. Just make sure. Ask. If you guys, that's what we're here for, you guys. Ask, please. Let me see what else we got here. Go to my questions. All right, cool. So we talked about what we do. Titan Ultra, Therapy of the Week. I want to go over it one more time. I covered it last live we just did, but I think it's very, very important. NADH, carnosine, B12, taurine, all 4 in 1 injection. NADH, we say become limitless because obviously it's helping brain cognitive enhancement almost. At that point, it's helping me with my memory. It's helping with a lot of different things. It helps a lot of different patients. A lot of different patients have used it for an ADD or an ADHD alternative. And we go back to that now. That's prescribed more and more. More and more of our kids are going on these drugs. It's true, okay? They're controlled substances. They can be addictive at points. They're making some people feel different than what they need. Now, how do they come up with the idea of a person or a patient or a kid going on these medications? Do you guys know? And I'm sure some of you guys do, because you guys might be on these medications. So what did you do? Did you do a blood test? No, there's not a blood test that will test out for that. Did you fill out a questionnaire or form? Probably. And at that point, the way that they score that is determining if you are ADD or ADHD. And I believe some people could possibly be. It might be a chemical imbalance. It might be a hormone imbalance. Have they ever checked those hormones of those people to see are their hormones optimized? Probably not in a lot of cases. I would probably bet a lot of money on it. But if they did, they might be able to help different people, because a lot of different people go into the doctor with symptoms. And these symptoms, a regular person doesn't know. I have low testosterone, or I might have a hormone imbalance. It's just those words are thrown around a lot. So at that point, when you have these symptoms, and let's say it's depression, let's say it's erectile dysfunction, let's say it's concentration, let's say it's energy. You go into your doctor and you say, hey, listen, I have concentration problems. I feel I'm in a deep, dark place. I'm gaining all this weight. My libido's not there. I have ED. My wife's upset with me. I just don't know what I'm going to do. Doc, help me. What do I do? You know, in 5 minutes or 10 minutes, they assess those symptoms with you. They breeze through your chart, guys, and at that point, they're usually putting a couple different medications in your hand, like an antidepressant. They're giving you a libido enhancer, like sildenafil, tadalafil, you know, and they're telling you, hey, you better, you better chalk up on your diet, and you better start going and doing some more activity and get some of those pounds off. You know, at that point, you got to look at it. Are they really, treating the problem, or are they putting a Band-Aid over the bleeding wound? And a lot of the times they're putting the Band-Aid over there, and it's just what it is, guys. So let's pick some people for the Titan gear. All right, I'm just breezing through here. All right, so the first guy is Pete G77. You have won the Titan gear on Instagram. And he put it up twice. That's smart, guys. I would put it up as many times as you can. I mean, don't go crazy on the timeline, but if you put it up a couple times, that's fine. Now, what I want you guys to do before I pitch the next person, if you are on Instagram, please put @ and tag 3 of your friends, family members, somebody that would benefit from maybe a Titan Medical Center therapy, blood work, maybe want to just get an overall checkup on their health and see if they're optimal in their health. We can help out there. All right, if you're on Facebook, so I'm looking at you guys. If you're on Facebook, I want you to share. So at the bottom of this live, there's a little share button. I want you to click that share button, and I want you to share it with 3 of your friends. So I'm going to look at that next for the blood test. You guys got to start doing that, and I'll start picking you guys. I just started my regimen 2 days ago with my Titan meds. Oh, nice, West Coast. Nice, Johnny. Let me know how it goes, dude, all right? I want to know. And that's another thing, guys. We're very in tune to our patients. Me and Sharice here every day. We know what's going on. We're very in tune. We try to look at every patient if we possibly can. We can't look at every patient because we've got so many. But at that point, we do keep a close log. But if there's an issue, you guys always can reach out. And you guys can reach out to my personal Facebook or Instagram or Facebook. I'm always looking at those social medias. We don't have a social media manager. Nobody does social media except for me. Production is my man behind here, Art, and that's it. So at that point, if you have a problem, you have a concern, you have maybe some positive feedback, maybe something that can make us better for more patients in the future. I'm all about that, guys. I have an open mind. I want to make things better. I'm all about progression, moving forward, and making sure that you guys are getting the best therapies and first-class service, because that's what it's really all about, guys. All right, cool. All right, Bassandra. So for the blood work, you need to tag 3 friends at whoever they are. All right, Peter G wins first. All right, so I already did. I'm watching live stream. Sheila, what's up? How you doing? I like to see how everybody's doing out there. I appreciate everybody tuning in. So let's go down to the next thing that people bring up to me a lot. Weight loss. John, what do you have for weight loss? You guys do weight loss. So what do you guys do for weight loss? What do you think is the best thing that I should do? What are you doing for weight loss, John? What do you do? Because, the next live, I'll try to put up some pictures. When we started Titan Medical Center, I've literally gotten better body-wise, feeling-wise, and mentally being on these therapies. And I've been on these therapies consistently. I'm very regimented, and I'm very, very strict on what I do. That doesn't mean I'm strict on eating. I live a balanced life, and I believe about being balanced. And balanced is not going to one extreme or the other. So at that point, if you're planning every single macro and nutrient and this and that, I mean, listen, if you're doing a contest or something competitive, I understand. But day-to-day living, that's just not, it's not optimal. Is that really quality of life? You might get a small percentage of people that do enjoy it. Like myself, I eat the exact same thing every day. I have for like the last 2 years. I thoroughly enjoy it. I do. So I don't want to change it. But a lot of people they can't relate to that. They're like, listen, I can't do that. I want some taste. I want some flavor. I want this. I want that. You can't have your cake and eat it too in all the circumstances. So at that point, you got to pick and choose, and you got to see where you want to be. So weight loss, ECA Stack Plus. ECA Stack Plus is by far one of the top selling therapies at Titan Medical Center, as far as that goes. And not just for weight loss, for energy. It does help with concentration, and there's some counterparts and components in there that help boost the natural metabolism of your body. So why is it good for weight loss, and why is it a great weight loss alternative? And weight loss alternative, I want to bring that up because most of the weight loss clinics that are out there, they usually give patients FDA-approved appetite suppressants. And what are those appetite suppressants? It can be phentermine, it can be fetromethazine. That's a short-acting and a long-acting appetite suppressant. At those points, it's like almost like methamphetamine to a degree. They can be addictive. They're controlled substances, and after a time period, people can build up tolerances to them, and they start using it as a crutch, and then it keeps going on, and then it's not even effective to their body. So why are they even taking it? So at that point, they really got to look into it, like what alternatives are out there. So the ECA Stack Plus is great because it has ephedrine, HCl, real ephedrine. You can't get it over the counter. Okay, it can only be prescribed. It has caffeine in it, so it has ephedrine, which is great for weight loss and fat burning. It has caffeine for energy. Both those things together are going to create a great weight loss environment. It's going to give you concentration, good natural energy, no crash. Now the plus that's onto it, we wanted to make it better because ECA has been around a long time and been used by a lot of people, guys. So at that point, what makes ours better is the Stack Plus, is the B12 and the chromium that are added on there. We know that those are going to be great for adding more weight loss effect and boosting metabolism to naturally burn like carbohydrates and fats in the body. So at that point, you're getting a lot of bang for the buck. And it's a capsule, so it's not injectable. This is one of the therapies that is not injectable. And I am a fan of injectables. I don't like to do injections, but the retention rate's there, so I always want to get the best retention. If I got to do it, I want the best, right? So do you guys. I mean, you just don't want to take it and not get an effect or get very little effect. You want to get the biggest, best effective if you're going to take something. So at that point, it is a capsule. It's very effective. A lot of our patients use it. I've used it. It did help me cut down quite a bit when I wanted to cut down and really want to get lean. If we had shoots, I got to travel, I got to go to conventions, whatever it is. And this upcoming year, 2019, is going to be crazy. The franchises, the book, everything's coming out in one big time. So at that point, I got to look my best because we're all underneath the microscope from somebody, whether it be a boss, a teammate, a significant other, just yourself. I think we're our biggest critics, right? Always, and that's just what it is. So when you're your biggest critic, you're looking in the mirror every day and you're looking for every little flaw, and you will see every little flaw because you look at yourself the most. It's just a natural thing. So at that point, so weight loss effect, ECA Stack Plus. Now, some people have cardiovascular issues and stuff like that. That's not a good option, guys. All right, so we don't want to hurt you guys. Health is number one priority. We want to make sure you're taken care of. So we're going to look at that, and a medical provider that's licensed to do so will make that decision. It won't be an HRT consultant or somebody you're just talking to on the phone that you have no idea if they have medical credentials or not. And I applaud you guys to ask them, are you medically certified to recommend or prescribe this medication? And at that point, that doctor will do it, even if they're going through the medical assistant and relaying the information. But that doctor is on site and right there to be able to tell you, okay? So at that point, you guys got to check on that. You guys are changing my life for the better. You found things in my blood that needed adjusting that I never would have thought were my issue. Now I feel better than I ever have in my life. Gerald Delgado, thank you, man. I appreciate it, dude. I really do. And listen, if you guys are Titan patients and you haven't got a Titan V-neck, you text the line. Every patient can get a tote bag and a V-neck. They're not going to get a Nike one or a special one, but you will get a Titan V-neck, and they are very, very nice. They're very costly to me, but they're nice. They're first class, just like our therapies and just like our service. I believe in doing it the best I can if I'm going to do it. So whether it's in the practice or it's in the service or it's in our clothing, you're going to get the best and you're going to get the reliability and credibility because it's me and Sharice's name on the line with Titan. We created this thing from the bottom and we are going to just skyrocket, I promise you. So we're just going to keep going up, guys. All right. I'm a patient at Titan. I would love a Titan V-neck. All right, so listen, if you're a patient, if you're a male, you'll get a V-neck. Just text a line, tell them your size, tell them you want a V-neck. They'll give you a tote bag too when they send it out. Tell them you want it sent out. Tell them John said so. If you're a girl and you get a tank top, you can get the tank tops the girls have, and they're really nice Razorback tank tops. So you guys get that for free if you're a patient, okay? With the tote bag. If you guys want, you guys can always purchase the leggings and stuff like that. If you want them, we have all that different good stuff. So that's the second weight loss portion. So what do we have that's natural that's going to help you with weight loss? So the two that we really go to would be Titan Complete, Tighten Up, and then the fat burning cream works really well. So Tighten Complete. So Tighten Complete, I should start with Tighten Up. Tighten Up has some of your B vitamins. It has one branched chain amino acid, L-carnitine and MIC. And then you have the Step Up, which is Tighten Complete. Tighten Complete has a lot of the B vitamins, the exact same as Tighten Up. It has all 3 branched chain amino acids, which there is only 3 branched chain amino acids, leucine, isoleucine, and valine. And they are essential amino acids that you have to get from some outside source. They do not produce, are not produced in the body. So at that point, you better have your nutrition on point. And I'll tell you what, I'm pretty regimented and I'm pretty strict on what I do, and my nutrition is not even on the best point it could be. And I own the business just because we get so busy, we get so tied up. We have lives, right? So for me, you know, I mean, food, I'm not a foodie either, because I look at food and some people love food and they love the taste and love their palate and this and that. Me, I look at it as energy and fuel. That is what it is to me. When I look at food, I'm like, listen, what's the best energy source? What's going to be the best for my body? Now, listen, the enjoyment of ice cream and stuff like that, I'm a Haagen-Dazs guy, so you know I'm going to get it, right? So, there's certain things, exceptions, and that's where we talk about balance, and that's where we come to that play. So, Tighten Complete and Tighten Up. These work great with ECAs together. Now you're taking an oral form, you have an injectable, you have 2 ways you're hitting, you know, that weight loss, you know, trying to get that fat loss, leaning up, drying out, right? Now you have the Tighten Fat Burning Cream. Now you have a topical version. You're hitting all 3 aspects, oral, injectable, and topically. So at that point, when you have that, you're hitting all 3 different aspects. Now the Tighten Fat Burning Cream, it does not burn fat. So I don't want anybody to get misconstrued, misconception, or get their hopes up, because it doesn't burn fat. What it does do is you apply it to the areas, it shrinks the fat cells in those areas, starts tightening the skin, makes the area look more aesthetic. So a better look. It was originally developed for patients that, you know, they were moms and they wanted to go by the pool, and they didn't have the best aesthetic look on the back of the legs, maybe some cellulite, maybe some troubled areas, the stomach area and stuff like that. I've seen guys use it on their necks. I've seen a lot of different applications for it, and you can use it pretty much everywhere. And it's very effective. Now, used over time with cardio and stuff like that, screams usually. People sleep in them with a scream or a saran wrap. That's like the homegrown way, I guess. And at that point, like, they use it. So it works really effective. I mean, a lot of the girls, they love it. A lot of the guys, they love it too. So I know some big names that use it. So at that point, it's pretty effective, especially using all 3 together. So that's really, really cool. All right, so let's talk about HCG, right? HCG weight loss. I've got some videos on YouTube covering this in full. I'm just going to hit on it. So HCG weight loss. So when you take HCG does not create fat burning, right? It doesn't create fat burning. And how should HCG be used? So HCG should be used in a calorie deficit scenario. Now, are you going to get enough calories in to be able to sustain the muscle without going to a catabolic effect or anything like that? Because that's a big worry for a lot of people, which I don't know why, because a lot of people don't fall in that category. They have a lot of calories to burn before they're ever going to go to a catabolic state, right? But it's a big worry, and that's where people start freaking out, and cortisol starts coming into play, which could create a negative environment for the body and start creating fat deposits and water retention, a lot of different issues. But HCG weight loss needs to be used in a calorie-restricted diet. Now, originally, the first HCG program was 500 calories, right? That, guys, is crazy insane. And, before I use HCG diet and tested it myself, because I test every therapy before I'd even endorse it or tell you about it, or I think that's even going to be good. Because HCG to me, 500 calories, yeah, anybody's going to lose weight on that, right? But what it does is it stimulates the other hormones in the body so you don't go into catabolic effect, and it stimulates those so you can gain or lean up on HCG. And it particularly hits those areas in the abdominal area, right? So the visceral fat, and that's what you really want to hit. You want to hit those stomach areas most of the time. But it'll create a great environment for the body, especially in calorie restriction. So don't get it twisted, guys. And it's used for fertility, right? We use it for add-back therapy when you're on hormone replacement therapy, like testosterone replacement. What you need to do is make sure that you're having the right medications there so you don't create a negative effect for you, or a problem that could happen later on in the treatment. So if you're on testosterone, we know this is for males, you're on testosterone, we know you're injecting, we know it's going to aromatize, the doctor is going to prescribe an estrogen blocker or aromatase inhibitor, okay? It's usually a Nastrozole or a Remedex. That's what a lot of people usually use. At that point, another thing that happens is when you start putting exogenous testosterone in the body. That means if you're putting it from an outside source, like injection, an oral form, like sublingual, or a cream, right? Like androgel. We know that the body's gonna just pick this up. It's gonna know, it's gonna understand that, hey, listen, we're getting this outside source. So, in effect, the brain is going to tell the testicles that, hey, listen, we don't need you to work because we're getting the source. We already got it, right? So you can just shut down. So what happens is this signal that goes from your brain down to your testicles gets shut off. And what happens in that fact is the testicles start going through atrophy. That's why the shrinkage, it happens, right? It happens to our testicles and they start shrinking, but that's where the myth of, your penis is gonna get smaller, your testicles are gonna shrink. This is why, guys. So they're in hibernation per se, right? So that's gonna, shut down a lot of different things. It's gonna lower your semen count and stuff like that. So for us, we don't want you to have any of these negative side effects. So with taking the HCG along with the testosterone replacement, you're getting that effect of creating a false signal, right, from the LH down to the testicles to hit the Leydig cells to ignite, so you can create, it starts getting that aesthetic look. The sperm count will usually go up at that point, and you'll be a happy man, and so will your partner, whoever it may be. So at that point, yeah, HCG, great for weight loss, calorie restricted diet. Don't make it crazy. 900 calories is what I did. Ooh, sorry, turn that around on you guys. So at that point, yeah, so just make sure you're just basing it on the facts. I even heard on some people on their HCG diets that you can't work out on some days or something like that. Guys, keep it real simple. Keep it easy. Keep the calorie restriction. Keep it bland diet, right? Exercise. We know if you exercise, you're going to burn calories. When you burn calories, you're going to lose weight, especially when you're going to a calorie deficit. It's a fact. All right, we know, right? As long as you're not eating garbage for those 900 calories, keep it clean, keep it bland, keep it consistent. Consistency will win the game all the time, I promise you. All right, so we covered those. Let's cover estrogen, high estrogen levels. Now, this happens usually in a lot of patients that are going to general practitioners. For guys, I'm going to bring this up. Or even females, but usually guys that are on testosterone replacement therapy, it aromatizes, right, and it goes into estrogen. And then, like, the primary care usually doesn't run an estradiol test on the patient because they're just looking at the free and total, and that came up, well, everything else should be okay. So at that point, what happens is your estrogen levels start going up. Estrogen levels start going up for a guy is going to create the same exact effect as far as females, right? Water retention, irritability, bloating. For guys, possible gynecomastia. So at that point, you're going to have a lot of these different issues that could possibly arise. We know that estrogen, high estrogen levels fuels cancer. We know this in, female patients, breast cancer patients. We know this, and the reason is we know it's aromatase inhibitors. Aromatase inhibitors were not made for males. They were made for females. They were made for female breast cancer patients, post-op and pre. So at that point, and they've gained levels through the years, guys. I mean, it's a problem. There's a lot of hormone problems out there that a lot of doctors or people don't even know about, or don't even, they don't want to tip their hat and look at it. But it's a fact, and that's why these drugs are out there. So tamoxifen, right? You got anastrozole, you got letrozole, extemicin. There's a lot of different ones out there, and they are stronger and stronger as you go up. So at that point, estrogen levels, make sure you keep them in check if you're a male or a female. And for a female that's just going to an OBGYN, usually they fill out just like the symptomatic form of what they are, and they might be 30, 40 years old, 50 years old, and the doctors don't even run blood tests on them. They just prescribe them synthetic hormones and send them on their way just by the symptoms that they tell them or they read off the paper. So guys, don't do that. Wake up, do some labs, get some numbers in front of you. Then, with your doctor, whoever it may be, licensed practitioner, make the decision of what you want to do, have them go over the risks and the benefits with you, and make a valid, educated decision, right? Because it's your health, we keep going over that. My PCP refused to get my labs done on my hormones, saying that they would be up and down because of my age. All right, so Deanna, all right, so that's what they say. So they say that hormones can fluctuate every day, right? Every day. But we know that you're going to get a reading on those hormones, and at least we're going to know where they're at. Now, you can do a follow-up on some of those hormones that you might have a concern on. Like I said, you don't have to do the full panel every time, but you will get a median or an average of those tests if you do 2 or 3 possibly. So at that point, that's why you run the multiple tests, and that's why you see where it comes back as. Because even labs, I mean, you might get a skewed lab here or there too. So at that point, if you have a skewed lab, you know, you want to run a retest. So if something comes back off, high, low, alert, you always want to run a retest on it. Don't get like freaked out just, you know, right away. Now if a second one comes back and there's concern, you might have some worries there. So just at that point, you know, be cautious and make sure that you guys know what you're doing. All right, so the next thing, and then we're going to get into is the free blood test. All right, so GH alternatives. So growth hormone, we know everybody knows about growth hormone. We start seeing these ads for topical growth hormone, spray growth hormone that you can buy over the counter. And at that point, you don't want to go with any of those things. Those over the counter things are not real, right? They're not real growth hormone. Real growth hormone is very expensive, and it's hard to get it prescribed by any practitioner because it's frowned upon to be prescribed unless it's prescribed for FDA approved therapies like dwarfism, adult growth hormone deficiency. You know, there's a couple things. AIDS wasting patients. There's a couple patients that fall in that category. But alternatives, what is alternatives? And that we offer. So IGF-1, LR3, it's awesome. So when you take growth hormone, we know you need to take growth hormone, and at that point it goes to the pituitary, down to the liver, and at that point it converts. It converts into IGF-1, 2, 3. At that point, this IGF-1 level is what you get all the benefits from, per se, growth hormone, anti-aging effects, skin elasticity, libido, all that energy, you know, lean body mass, and that's all we're looking for. It's always quality over quantity. Don't try to be the biggest guy in the gym. Try to be the best you. At that point, the leaner you are, the better as far as that goes. Not too lean. I mean, not deathly, but you know, if you're keeping it around 8, 9, 10%, you're doing well at that point, and you're looking well, and you're probably feeling good too. So at that point, look into that therapy. Now, IGF-1 therapies aren't for everybody. If you have cancer in your family, if you're a cancer survivor, there's something that looks off, then that's definitely not a good therapy for you, okay? The other ones like GHRHs, growth hormone releasing hormone peptides, GHRPs, growth hormone releasing peptides. These are like Semerelin, CJC, MK677, Imperelin, GHRP2, GHRP6. Now, when you start categorizing them, put them in categories. We have Semerelin, you have CJC. They're both GHRHs, right? Injectable versions. And they are going to be growth hormone releasing hormones, and they're going to help your body naturally produce your own growth hormone. So you're not putting anything in the body to, synthetic growth hormone per se. So at that point, it's going to help your body, pituitary, stimulate your own growth hormone. So then at that point, it's not going to go over in abundance. The difference between the two is Semerelin is just a really old dinosaur that used to be there, where CJC 1295 is the new and improved. It's got a longer half-life. That means it stays in the body longer. So that means you're going to get a better effect. You should be getting a better result. It should just work overall better, okay? So CJC 1295 is definitely my pick out of those two, and it would definitely be the best for the GHRHs. Now, if you don't like needles, MK677 is the only oral GHRH out there. It works. It has clinical studies behind it. It's prescribed. It's helped a lot of different patients. So at that point, you guys might want to look into those. Now, like I said, if you have cancer or something like that, then those could not be, might not be the best therapy choices for you. So just look into those. Those are really good. But those are going to help with lean body mass and weight loss, okay? So definitely check those out. The next thing, let me see what we got here. Okay, so let's do it. Waist bringing it in. So what are my tricks to waist bringing it in? So I don't do any cardio, guys. I should do some cardio for cardiovascular purposes. A lot of my stuff is weight training. We know that the more muscle you have, the more fat you burn. The leaner you are, the better. Like to that degree, not getting sickly, lean, but to a degree. At that point, what I'd like to do is I like to eat a bland diet. I'm very, very restricted on some of the calories I'm doing. I know what I'm intaking every day. That's why I eat the exact same thing. And just being cautious and wary. I think that's the biggest thing. Looking at labels. I taught my 9-year-old when he was 6 years old to look at labels before he eats it. Whether it's cookies, whether it's a drink, whatever it is. I don't care that he eats it. I want him to know what he's eating. I want him to know what he's intaking. It's very important to look at labels. Don't look at the smoke screen or what they're marketing, advertising on the front. Look at the label, guys, all right? I implore you to do that. Check your calories, too. A lot of these places have their calories. I think it's a law in some states and most arenas that they have to show you the calorie counts. Keep track of those calories. There's apps out there that do it real easy. They got scanners and the whole nine. So if you really want to do it, DC Baker, you already won the blood work. You won the blood work the first live. I need the blood work. DC Baker, you won the blood work. Text the line, 727-389-3220. Okay, all right, guys. So let's do the giveaway for blood work. We're going to end this bad boy. All right, so blood work. Let me go on Instagram. This is awesome. All right. All right, so for Facebook, I'm going to go off the page, the lives, and then for here, I am going to do it off of Instagram, and I'll pick, all right? So let's see what this is. All right, let's see who comes up. Who's going to come up? That's the question, guys. Wow, 72 comments. All right. All right, Scale17 on Instagram. He's from the East Coast. Scales, Steve Scaly? Scalia, Steve. You are the winner. Blood work, full male panel, man. Congratulations to you. You'll get everything checked out. Please text the line 727-389-3220 so you could win the blood work. All right. Let me go to the next one. UT Julie 81. Number 30 you picked. You do have to open your account though. So at that point, UT Julie 81, you have won the blood work. Please text or call the line 727-389-3220. And that is for Instagram. Now remember guys, we have blood work, right, at discounted prices for everyone. So at that point, if you need it, you can get it at a discounted rate. For females, it's $195. For males, it's $130. We've never done that at this rate. So please take advantage of it. Tell somebody right now. Share it if you're on Facebook. At the bottom, right down there. Please press the share button. Send it out to some friends. Share it to some people's pages. Please. If you're on Instagram, please check this out. At 3 of your friends. At 3 of your friends. Please help me out. Get them involved. I want to make sure they're taken care of too. All right, so Facebook, what do we got here?
Looks like pretty much everybody.
Samuel Rivera. He entered himself in twice. Wow. Very, very cool. Who else do we have? One more on Facebook. Let's do it. Let's do the scroll.
Use some dramatic music.
Da-da-da! Who's going to win?
It's a lot of scrolling.
Sheila Lambert? She entered herself in. She was on 3 times.
Yeah, I was chit chatting with her on the thing. She was like, "Did I do it right?" She just kept doing it.
So guys, you entered yourselves in. You had a bigger chance to win for sure. She shared it and she put it to 3 different people. That's awesome, guys. Very, very cool. So guys, that's what we've done so far. So for the amino acid visit, we're going to blow it up. The 10th person to text #amino, you will get an amino vitamin visit for free. Text it to 727-389-3220. If you're an old patient, you can get the same thing. You can win too. And we'll announce the winner on the next live. So stay tuned, 6 p.m. Be back. #amino. Text it to 727-389-3220. All right, guys? And we'll be back after these messages. I appreciate you guys tuning in, 6 p.m. If you're on YouTube, please click the subscribe button. On Facebook and Instagram, share this and tag your friends, guys. 6 p.m. I'll see you guys back here. John from Titan, and I'm out.